And we're back at the New Health with Dr. Cheng Ruan, CEO of the Texas Center for Lifestyle Medicine. Welcome back, Dr. Ruan.
Hey, thanks a lot. Thanks a lot for having me here.
So glad that you're here with us. So we've spoken a bit about your work, a little bit about your clinic, and I know that we've talked before a little bit about loneliness. We mentioned
Yes.
that last week. I'd love for us to touch a little bit more. You said loneliness is one of our greatest epidemics of our time.
Yeah, not one of it is the greatest epidemic of our time.
Okay.
And you know, when we look at loneliness, most people think of like actually being isolated. No, but a lot of people like being isolated. My wife loves to curl up and read a book, and I take the kids out to go swim. Like, that's not loneliness. So loneliness is a sense of isolation. So that's the first thing to define. The actual sense of isolation contributes to all chronic disease. This is documented in the WHO, this is documented in the CDC, it's everywhere, right? And so loneliness is the biggest social determinant of health in terms of risk factor for morbidity and mortality. So mortality is how long you live, and morbidity is the disease that gets developed, right? Mm-hmm. So when we look at data, a lot of people with both mental and physical health issues, the more lonely they get, the worse they get. But what happens is when there are more reach outs and touch points between family and friends and church or temple or whatever it is, like within the community, the disease states, they magically either stabilize or they even kind of go back, right? Mm-hmm. And so the idea that we should see loneliness just as a mental health issue is kind of silly, to be honest with you. And you know, I'm a data guy, so as a data analyst, we look at factors of what's causing disease states. So let's go back to 2018. We're at Texas Center for Lifestyle Medicine. We're a year old, and we're like, you know what? I'm gonna get in because I'm a data scientist and look at what are the factors that's creating disease. Autoimmune, cancer, Alzheimer's dementia, metabolic disorders such as diabetes, right, and hypertension, 5, right? And I was like, okay, well, is it a supplement? Is it a diet? Is it vegan? Is it paleo? Like, yeah. What is it? As it turns out, it's none of the above. Mm-hmm. It's life events. So we had a thing called LE, like life events. Okay. So it could be a marriage, it could be a divorce, it could be a death of a parent, a death of a child, some life event that required the patient to have a switch in identity, okay? And that triggered some change. And sometimes we can see these life events as quote unquote bad, like a death of a parent, but then all of a sudden the disease states start improving. Like what's going on here, right? And so we shouldn't really be labeling things are bad. We should be really labeling, well, what are people doing? Because whenever you have life events like this, you gather your friends, you have the community, you go to church again, right? It's like you all of a sudden adopt this community and that sense of isolation goes down, right? But what happens is, and we all do this, I do this too, whenever you're going on your day-to-day, you're doing your job, you're doing your thing, you just get stuck in like automatic mode, right? Mm-hmm. And when you get stuck in automatic mode, you don't stop to smell the roses, if you will, right? And your brain is constantly thinking about the future, which we call anxiety, or constantly thinking about the past, which we would call depression. Okay? Yeah. And neither is really that constructive for health. So when we look at these data points, like these are extremely important data points. So now in 2018, we're like, well, how can we decrease the biggest risk factor in morbidity and mortality? How do we do that? Well, we get people together so they don't feel isolated, they don't feel lonely. So we started groups, whether it's diabetes or dementia. We had a military veteran group, focus group, and now I think we're up to like 21 groups now, right? It's a lot. And these groups are amazing people that we actually learn from, and we track them over time. So the question is there data that people coming together in groups actually improve disease states? Yes, that was first published in veterans hospitals and veterans programs, right? Now it's published, there's Cleveland Clinic and all sorts of different places that are published. We even have a publication looking at loneliness isolation and decrease that and improving outcomes as well. And so the idea that loneliness itself can be a risk factor for disease is not that surprising. Humans are designed to be in packs. We're designed to be in tribe. We're tribal people, right? And because we're tribal people, we have to feel like we're a part of the community. So if that's the case, wouldn't the parts of the world with the best communities have the longest living people? What do you think?
Yes.
Yeah, these are called the blue zones,
Yes.
right?
Yeah.
The blue zones, and you can watch these, documentaries on Netflix and everywhere like that, right? What is the one factor that ties everything together? An impeccable sense of community. The older you are, the more you're cherished. The older you are, the more you're cherished, right? And that's what we want to do at Texas Center for Lifestyle Medicine. Wisdom comes with age. And guess what? When you're cherished, all of a sudden your memory doesn't decline as much as it should be, right? Mm-hmm. And you're more involved, and there's a lot of joy there. Is because like when we value seniors, mm-hmm. I mean that is when the entire population of humans can thrive. And we used to be that way a lot, but I think we're going away from it.
Yeah. So tell me, what can some of our viewers at home do when it comes to this loneliness? I mean, you are in Houston, right? So people can find you and find your groups and join, correct?
Yeah, absolutely.
So, and beyond that, what else could our viewers at home do?
Yeah. So first of all, I think really simply, and if you're thinking about loneliness and isolation, you should have a quick audit, right? When you wake up, what do you look forward to in the morning? And if you have a hard time thinking about that as an answer, then there's loneliness and isolation, even if there's a lot of people around you, right? Mm-hmm. So that's a good audit. The second thing is when you do go out, how many times per week are you doing things just for you? Like just for you, okay? Not your kids, not your wife or husband, just for you. If that's under 3, then perhaps there's a bit of isolation that's there, right? So that's the second audit. And the third audit is ask your family, how have I been showing up and presenting myself to you? That takes some work.
Yeah.
But those are 3 really good audits that if you do that almost on like a weekly basis and track that, you'll realize a lot of things about yourself, and then you can make decisions to really impact you. And if you do have chronic illnesses, disease states, mental health challenges, physical health challenges, we do have a ton of groups here at Texas Center for Lifestyle Medicine. So it's texascenterforlifestylemedicine.org. You can request to be a new patient, or if you're watching this, you're already a patient, hello, come into our groups.
Oh, that's wonderful. So when we're talking about, I love what you're saying about asking your loved ones how you're showing up for them.
Yeah.
I think that's wonderful. I know that takes a lot of safety, feeling safe in yourself to be able to ask that question in the first place.
Yes.
So do you have groups where you talk about those internal mechanisms?
Absolutely, yeah. We talk about that more than we talk about anything else. We talk about relationships more than anything else. So Jenny Moreno, she's wonderful. She's a mind-body medicine practitioner in our facility. And we also have a clinical psychotherapist, Tina. They do an amazing job at getting these group discussions out. And I will tell you very often that some patients can only open up in our groups and not necessarily at home, right? Which is a really, really common thing. Or they don't feel like they have anyone to open up to because they don't really understand what they're going through for disease states and stuff like that, right? But it's not an easy thing, especially if you have a history of traumas and triggered and stuff like that.
Yeah, so you have people in your facility, they help coax people getting through that and learning how to maybe communicate more with people?
Oh yeah, absolutely.
That's incredible. You teach language skills or?
Communication skills, well not just skills. I wouldn't say we teach, we listen more than we teach. Okay. And honestly, listening is more important than teaching. And that's what we found. So a lot of times we give space. As long as we give space for people, humans tend to do well.
That's great. So no matter what the disease state is,
yeah.
It's diabetes or it's high blood pressure or cancer, it still seems to be pretty similar format so that people feel the inclusion in the community?
Yeah, it's the format's really similar, but the topics are quite different. And we have a lot of rare diseases in our organization because people usually end up seeing us and they have nowhere else to go. And so we have a lot of rare diseases in our population. Actually, our largest programs are actually pretty rare diseases. But they come together, we give them a space. And guess what? I don't make the programs, the patients do. So if patients want a group, like, okay, we can create it for you. So I'm very big on not just creating things because people want it, but creating things because people want to talk about it in a safety net in the community, and people are there, and people in the group know they're there to take, and they're also there to give. It's a two-way street, right? And so every patient contributes to the group. So we can have the same topic on 2 different days. If the patients are very different on 2 different days, the dynamic's totally different too.
And the topics are focused more on lifestyle, like this is how you cook, this is how you eat right, or is
topics are more like, this Friday we have a group called How Your Belief Systems Stimulate Autoimmune Disease.
Oh.
We have ones on spirituality, integration of emotional intelligence into daily life. We have groups that are focused on the eating and the diabetes and cooking and stuff like that with my dietitian, Ruben. We work with a local chef here who's executive chef for Levin Baking Company and Levin Cafe on healthy cooking and longevity eating. So the range is very widely cast. And then our favorite groups are Ask the Expert series, where we bring doctors in focusing on a specific topic. And often these doctors are booked out for like a year and no one has access to them. But we love to bring those doctors into the community.
And you have access to those doctors, and that's incredible. And covered by insurance, as you said.
Yeah, absolutely, yes.
So Dr. Ruan, thank you so much for being with us again today. Can you tell everyone what you're working on and how people can reach you, please?
Yeah, so you can reach me by searching my name, Cheng Ruan, MD. So I'm usually on Instagram a lot. And for those people who are interested in connecting as a healthcare professional, find me on LinkedIn. Website is texascenterforlifestylemedicine.org. And what I'm working on is adopting technology into our systems. We've developed artificial intelligence technology to look at really complex disease patient cases who help us with diagnosis, and it's becoming a daily thing. We actually diagnosed 2 really rare things on 2 different patients yesterday that over 30 doctors have missed in the past because of our technology. And I'm really proud of my team for developing that.
That's incredible. Thank you so much for being with us again, and I know you'll join us next week.
Yes, absolutely.
Very excited to have you back. And thank you for being with us here on The New Health. Please join us next week, and we'll see you then.
This has been a Now Media Networks feature presentation. All rights reserved.